Yeah, so all of us around about the age of 50 should really be starting to think about our bone health. And the reason for that is minimal trauma fractures. But before we go any further, I will remind everyone that, as usual, a podcast cannot replace an individual consultation with your own healthcare professional. Dr. Moz, minimal trauma fracture, tell us about those.
It is exactly what it sounds like. It is having a fracture from a version of force that we think is probably not reasonable to generate a fracture. And so classically, the definition is, a fall from standing height or less, or, that you've touched something slightly hard and ended up with a fracture. And so most often we'll see these on sort of the hip, the spine, the wrist, the ankle, common places that, well, not uncommon places to get a fracture with very little trauma. So they're increasing. They're a common cause of harm as we get older, aren't they, Dr. Anne?
They are. Again, the stats would be that from the age of 60, the lifetime risk for a woman is 44%, and the lifetime risk for a man is 25%. So really very common. And the problem is that usually your quality of life is really impacted dreadfully by having one of these. That is, for a hip fracture, 20% of women die within the first year. And in fact, nearly 30% of men die within the first year as well. And half of those deaths occur in hospital while you're still recovering from the actual fall and fracture. And for those who don't die, whether it's hip fracture or something else, your quality of life rarely has recovered within 18 months after the fracture. So we really don't want to be having them.
We don't. And I guess thinking about it early is a really good way to try and mitigate your risk, because it's really hard to change habits once you're a little bit older and sort of, or once you've already had your minimal trauma fracture. So we really do want to try and manage it from early on, don't we?
Yeah, we do. So this podcast is probably primarily aimed at people from the age of 50 and up, but we reach our peak bone mass around about the age of 25 or 30. So we're set up from our starting point from which we decline in our 50s and on. We set that up much earlier in life. So there's definitely something in the podcast for younger people. And even if they think that they're Teflon, they can share it with their mum and dad, And my mum and dad will be in the target group if you're not yourself.
Yeah, so I mean, I'm in my 30s, and I often actually think about kind of bone health and how to try and improve that, because I think you see the impact that it has on the older generation. Like you said, you hit that peak quite early on in the piece. And I think even though we're targeting at 50s, people in their 30s and 40s should be paying attention and thinking about how to sort of implement some of these changes so that they don't have to make wholesale changes in their 50s and 60s.
Yep. Absolutely, very happy. So what a surprise. The Health Podcast is going to talk to you about diet, about exercise, and about lifestyle. Who would have thunk it, Dr. Moz?
Indeed.
Things that are going to impact our bone health.
Don't switch off the podcast just yet. We're not done. There are some specifics around diet, right, lifestyle, and exercise. So let's get into
some... in the detail, as always, for all of these things.
But bone health, I've got to eat well, got to move more. Got it? Great. Switch off. Next podcast.
No, there's some details. There's some details. Okay,
so calcium.
Calcium, we will start with calcium. Calcium is an essential element for the body, and we can't make it, so we have to get it from our diet. There's no other way of us getting it. Bones are, I think, about a third by weight calcium, and about 99% of our body's calcium stores are in the bone. And the reason that is really important is that the body will maintain your blood level of calcium however much you do or don't get in your diet. So if you don't get enough calcium in your diet, your body will just remove it from the bone to do the other things that it does, because it does do other things other than make the bone hard and strong. What else does it do, Moz?
Yeah, of course, we need calcium for lots of other things. So we need it for transmission of nerve impulses, sending signals around the body to do particular tasks. We need it to ensure that our blood clots appropriately. We need it for some hormones require it to sort of be transmitted and send the signal across. And of course, we need it for muscle health as well. So lots of jobs for calcium in and around the body. Extremely important, mineral to be found in the body.
Absolutely. And sometimes people will say to me, can we just check my blood calcium and see whether I need to take calcium supplements? And I understand that seems very logical, but because calcium is so important to the body will keep your calcium level normal, whether you're getting enough or not. So it doesn't tell us whether you're getting enough at all.
So it sort of robs Peter to pay Paul. So
Mm.
if you don't actually have enough calcium, your blood calcium will remain normal. Because as you've said, Dr. Ann, you just steal it from the bones to sort of look after all the functions that you need in the body. So we'll never know about whether your bone calcium storage is adequate or not.
Yeah. So getting older sucks at lots of levels, and one of the things that's quite sucky about getting older is that you become less efficient at absorbing calcium from your gut. So the end result of that is that the recommended daily intake of calcium increases as we get older. So
Mm-hmm.
for women over the age of 50 and men over the age of 70, the recommended daily intake of calcium is 1,300 milligrams. For younger people, it's 1,000 milligrams. But the average Australian daily intake is about 750 milligrams. So most people are not getting enough calcium. And
Mm-hmm.
once you are a postmenopausal woman or a man over the age of 70, you are super unlikely, probably going to be 500 to 600 milligrams short of calcium
Yeah.
in your everyday diet. So, what would 1,000 milligrams of calcium look like, Moz? What would you have to be eating to get that sort of thing
So
in your diet?
I often I have seen the show notes and often I think about it in terms of serves of calcium, and so you can perhaps let me know whether I'm misguiding my patients. But I often think about at least 4 healthy serves of calcium. So you kind of want 3 full glasses is about so
Milk, yeah.
each full glass of milk is a serve. A pot of yogurt is a serve. You need several slices of, pre-sliced cheese, thinking like sort of 6 or 7 slices of cheese, or maybe a quarter of a kilo, 240, 250 grams of a soft cheese. Those are sorts of a serve of calcium, and you kind of need 4 of those to sort of keep you up to scratch. How'd I do, Dr. Anne?
I think you did pretty well, Dr. Moz. I would agree with just about all of that. The only thing to say is that if you're having a full round of full fat brie or camembert each day will be absolutely delicious, but it's a lot of fats and a lot of calories, isn't it? So that would be our difficulty if we're recommending people get lots of dairy to ensure they make their calcium needs. We need to step back and look at the bigger picture of it's not the only thing that individuals are interested in, and it's also not the only thing that we're interested in.